So let's talk about nutrition first. So we know that maintaining an ideal body weight is essential for physical health and emotional health. So maintaining an ideal body weight, not being overweight, not being underweight, but can help you in your physical health and also can help you in your emotional health. And one of the basic principles is that we should always aim for 3 meals a day with 1 or 2 snacks per day. And that can allow for good, healthy nutrition. So we know that research suggests that there are different foods that can have a positive impact on your emotional health. So some of the foods that can positively affect your emotional health include eating fruits and vegetables, eating whole grains like brown rice and whole wheat flour or oatmeal or popcorn, eating legumes like beans and peas, chickpeas, lentils, soybeans, peanuts, eating other foods like avocados and olives, eating fish and seafood and other things that have omega-3 fatty acids, which includes the fish and the seafoods, but also things like nuts and seeds and plant oils. So all of these research suggests that these type of foods can have a positive effect on our emotional health. Research also suggests that there are some foods that can have a negative effect on our emotional health. And those include processed foods, anything that is frozen, anything that is in a can, anything that is kind of a ready to eat meal is a processed food, and that can have a negative effect on our emotional health. And then refined foods can also negatively affect our emotional health. So refined foods, some examples include white bread, white rice, pizza dough, breakfast cereals, bagels, cake. There's others, but these are just some common things that we eat. And then sweet items and sugary type of foods can also have a negative effect on our emotional health. So we have to pay attention to our nutrition because the things we eat can affect not only our physical health, but also our emotional health. And unfortunately, as medical students, as residents, as practicing physicians, our schedules, we're busy, we're on the run. And a lot of times we end up eating foods that are processed foods or refined foods or sugary foods, which is not good for our emotional health. So we have to keep that in mind because this is very hard for us to do. We're given our busy schedules and given our time constraints, and it's easy to grab some sort of processed food or refined food or sugary food just to kind of keep us going and keeping us helping us get us through the day. But we have to take a moment and think about what we are eating, what is our nutrition like, and try to eat more healthy because that definitely has an impact on our physical health, but also our emotional health. So something that we need to keep in mind as healthcare providers, as students, as residents, as practicing physicians, that nutrition is very, very important, and we can't sacrifice good, healthy nutrition in our daily schedule. So we must make time for that and keep that in mind then.